If I have a kind introduction. Okay. Good evening, everybody.
Good evening.
Good evening.
Okay. Thank you. Only two voices are heard.
Good evening.
Good evening, Dr. Sharath.
Yes. Good evening. Yes. Nice to hear.
Good evening.
Good evening.
Welcome.
Thank you. Okay. Is my slides are visible?
Yes.
Yes.
Thank you. Okay. Here it's more like a interactive session rather than just to keep a monotonous. Just I'm going to give some speech and you're going to hear. Nothing like that. Okay. Initially, I'll be giving some of the brief introductions. Then later we'll be going to have an interactive session like things. Okay. Thank you. We'll go with the Namaste.
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 Other
Namaste.
please.
Namaste.
Yes, namaste. Yes.
Namaste.
So, okay. When we say namaste, we are open, right? We feel so happy. We feel connected, right? When we are connected, it is easy to give and share. Fine. Welcome you all on behalf of your UK Arogyam, Active Naturals, and the Unnati Foundations, and also from the place where the ancient wisdom was started and where the great masters have lived. Because this is all the knowledge, what I'm going to share is nothing belongs to mine, it all belongs to the universe. We have just access through some of the scriptures, and I'm just trying to put it as an instrument. So who am I? Because madam has given a brief introduction about me. Myself, Dr. Sharath, I'm a consultant gastroenterologist and hepatologist in nutrition. I'm going to deal with nutrition also with respect to obesity as well as malnutrition. And I'm a yogic healer as well as a trainer. And I'm an energy entrepreneur for more than 2 decades. I'm a clinical researcher and a principal investigator in the field of Biofield therapy in the Department of Research, which belongs to Untitled Foundation. So we have been working with this Biofield therapy for the past 20 years over different sectors, from the as simple as with the eye vision to the pain management, to the stress management, anxiety management, different body pains like chronic fatigue syndrome or fibromyalgia or any other joint pains, including rheumatological conditions. And also we have worked with more than 5,000 MBBS undergraduate students, which they have actively volunteered and participated in many of our mental health programs. So the objectives of the study is, I just want you to take through some of the PPTs so that you will understand what is Biofield therapy, what is yogic healing, how it is related, because we have put a yoga, right? So how it is related to yoga, because we have put yoga based Biofield therapy. So how it is connected between like fibromyalgia and a Biofield therapy, or any chronic pain syndromes and a Biofield therapy. Because I'm taking this fibromyalgia and a chronic fatigue syndrome or a body pains as because this is a more common scenario, and how yogic healing can help everybody to overcome their problems associated with these chronic conditions. Is the objectives are clear for you? If yes, let's go to a small clinical scenario, a story behind the years, because this is one of the case which I came across during my clinical OPD.
Now is the time for business and come away from the sessions with a path to bringing all the benefits of messaging.
Sorry, this one is on. Okay, fine. This is some of the story we routinely we encounter. There was a 25-year-old young female who actually came to my OPD. She's a software engineer. She's newly married, a married life of 2 years, no children. She was managing well with the family life as well as office. She was well balanced. She was giving time. Everything was running smoothly. But over 2 years, she found some part of the time she used to feel fatigue. She is unable to carry out. She is unable to concentrate. Some small things are like, but initially she neglected. She thought, okay, might be normal or just a more exertion or a stress, though I'm unable to cope up. So she just pushed on for a years. Then she obviously over time the mood fluctuation started. She started showing anxiety. in the form of frustrations, and also like unable to handle the family problems as well as the office. So gradually she sank into depression, futures of depression. She gone to the clinic, then she met a doctor, then diagnosed her depression, went on medication. Then how long? Then later, she was like over 1 year, 2 years, she went on, continue, but the things are not settling, still remains. This is one clinical real-time scenario which everybody encounters, right? Most of the people, at some part of the time, we feel we are lost in these things. Some part, at least, not exactly the matching, but some part will be matching with our life, right? Keeping this a real-time scenario, we'll go ahead. We'll see what happens. So how many of us has undergone or witnessed, at least if we have not undergone, we would have witnessed the people who are undergoing this. Age might be different, the problems might be different, but the outcome will remain same. Right?
Yep.
Yes. So here the people may express different problems. Most commonly what they physically they say muscle pain, muscle soreness, I am unable to carry out, I am fatigued, I have inability to do my routine exercise also. And there is a confusion and forgetfulness. There is a difficult to concentrate. Sleep is altered. Most of them, some people excess of sleep, some people may not get a sufficient sleep. But even if they are getting, they may not feel the refreshed. There is a mood fluctuation from anxiety to depression, unable to handle the task, whether it's in the home or office. So on, so on. It comes, and they are very fragile. They are very sensitive, even to mild mood fluctuation with their partners, with their children, or in the office with their colleagues. Even the climate change can affect them. If there is just an increased cold, they might get easily fatigued. They'll just become like, oh, muscle pain, I cannot move at all. Even somebody tells some words, they are unable to accept it. Even small infection, even just a throat infection or a common cold, they are not able to tolerate. So the person suffers in different levels. Further course, she underwent all the tests, which are normal. All the treatment options have been tried. They have been under control, but under medication. So if you look into if you dig into the history of any people who comes with this, either they will be having some family crisis, some childhood problems, abuse, have lost some near or dear ones, some harassment with the friends, relatives, or the neighbors, or it can be in the form of abuse with the family or in the workplace, or everything is there, nothing, no problem, but the person is feeling internally empty. So what to do? They doesn't know what to do, where to go, how to approach, and even they have tried everything, yoga, everything, but not getting. So that is the hopelessness, a state where person feels nothing is there for me. Why the God you are keeping me alive? The person goes to a level I should not live at all. So the problem here is a mind, the body which is unable to enjoy, but however unable to balance. So there might be some other perspective or other dimension of our life which is lacking in this. That's why we are unable to overcome. So the medications are there, then why you are unable? We are doing exercise, but still we are unable. We are doing all the other sorts of modalities, but still we are unable. Some people, they are mobile, they are unable to do. Some people, they are immobile because of the age factor, the comorbidities, they are unable. So there are so many conditions. There are so many situations where the people are expressing their inabilities. Let's see how this keeping the fibromyalgia and chronic fatigue syndrome as an example. We'll see how the people suffers. There are different because people not only suffers in one or the just mentally going for depression or physically having a pain. These are not only different dimensions of suffering. They have multiple body pains. Yes. Do you agree?
Yes.
Yes. Let's see. People might feel fatigued, decreased vitality, lack of driving force because they feel nothing is there. Why? There is no driving force at all. Right? This is also a part of suffering. Next come. They are having emotionally depressed because they are unable to carry out their activities. They are unable to go and work with their near and dear ones. So there are other mode of sufferings. Then they doesn't have any idea what to do, where to go, what are the things I can get in. Again, there is a suffering. There is an insecurity. then there's no happiness. Ultimately, at the end, everything lead into a state of sadness. I don't have the happiness in mind. Why I'm living? This is what end stage where the major depression sets in. Let's see in a different dimensions. We have medicines, right? We are taking this, we are taking this, we are taking this. We are addressing the body pains, painkillers. We are addressing the drain force. We take ginseng or so many other herbal medications or allopathy medication, anything. We are taking antidepressants, addressing it. Lack of idea, we are getting suggestions. But ultimately, are we happy? No, we are not. Because there is something which is missing. There is some link which is missing there. Is it right? Isn't it?
Yes, yes.
So this is what, after seeing so many things, so many people in my clinic, in my surroundings, I realized, so we need to do something else for these people. We need to help them out. So that's why I'm here. Why? Because they're having pains physically, mentally, emotionally. Their inability to manifest their potential, because they have a potential, but they are unable. Then it is affecting their family. They are unable to cope with the family stress, family people. The quality of life is much more affected than what other people thinks. Somebody might have lost the interest in life. They might have, some people have think towards the suicidal tendencies. Then people having goodwill. I want to serve something, but they are unable to execute because they doesn't have that energy, the vital force, the driving force. So these are all the reasons what made me to think, okay, we need to do something for this group of people which they are suffering, even though they are getting partially benefited with medicines, but something is missing which can be a better cure for them. So somebody has an idea but unable to execute. This is again the most important thing in an actively working group, or the who are earning for their family. So looking this in a different perspective, all these body pains are related to the physical body, right? That we call it as Annamaya Kosha. Okay. Next comes your fatigue, your vitality is decreased. There is no lack of brain force. That we call it as prana, or the life force. That is concerned with your pranamaya Kosha. Then you have an emotions. You are having a joy, happiness, sorrow, depressions, anxiety, everything. This is related to mind, manasu, manomaya kosha. Then you don't have an idea of where to go, means you don't have that intelligence. It is not the intelligence of the subject. It is what the inner intelligence. You don't have the clue for your life, where to go. There is lack of idea, what to do. What if I do, I'll get better. That is concerned with Vijnanamaya Kosha. Vijnana means it's an enlightened. Then is the happiness or the contentment that comes with the Anandamaya Kosha. See, we are having different sufferings. We are having different kosha which represent. Means our sufferings, our day-to-day life are dealing with different subcategorization of our emotions, thoughts, mind, and energy. So we not only lives, we always represent I, means I, the body, but we also have different koshas because we live with it. That is the Annamaya kosha, the physical body, the Pranamaya kosha, the energy body, the Manomaya kosha is the mind and the astral body in philosophy, and the Vijnanamaya kosha is the kosha of intelligence, knowledge, wisdom. Then the Anandamaya kosha, we live. So all these 5 dimensions we live. So many dimensions exist in our life. Many koshas, we live with it. So if one thing, suppose I'll give an example, if you're too much happy, what will you feel? You feel the driving force has come. You feel you are energized. Then it means that your Manomaya kosha is energizing your physical body, energizing your Pranamaya kosha also. Means each kosha can interact with each other, can communicate with each other, and can affect each other, so the other koshas can be taken care. So they are interdependent, they work simultaneously to make you better. So this is called as Panchakosha theory, or the Panchakosha concept, which has been mentioned in Taittiriya Upanishad. That is the basis of this yogic. We here use the concept of Panchakosha to deal with the problems, because each person has to be healed. Each person has to be worked on all these kosha to make him better. It never runs with one kosha, one dimension of application, because sufferings are there in multiple dimensions. You need to apply your work, or you need to work in multiple dimensions. Okay, do you feel that, okay, I am commenting physical body, you know minds and thoughts, right? You know, you have an idea, instinct, sixth sense, everything. But did you ever felt there is an energy? Shall we do an experiment?
Yes.
Yes, okay. Just hold your hand like this. Okay.
No.
Just fist and open, fist and open.
Show us. We can't see.
Can you see?
No,
Yes, yes, we can see.
I can't.
No, just
If you
scroll
stop
it. You
sharing
will
the
be
screen,
next screen. You will be getting my result. Now you are able to see.
No. I've got
Yes,
sleep.
we can see. Yeah.
Uska
Just
ask
hold
him
your.
to stop the sharing the screen.
Mm.
You want to stop sharing? Fine. 1 second. Yeah, now?
Yeah, we can
Yes.
see.
Now, yeah.
Okay, fine. So press at the center of the palm. Tips of the fingers. It's your own hand. With so much of love, so much of care, you can press, you can smile.
Yes.
Yes, right? It says twinkle, twinkle, little stars. When we are small kids, we are playing.
Yes.
Yes. Okay. Now just you can rub. Okay. Then place just 1 feet apart. Now close your eyes. Do a deep breathing. Take a deep breath. Inhale. Hold and exhale. Be aware of your hands. Close your eyes. Do not visualize anything. Do not assume anything. Okay. Then again continue to do the deep up down breathing. Do a deep breathing. Then move your hands to and fro. Just slowly continue to do deep breathing. Then just do rotation movements. Slowly. Be aware of your hands. Tip of the finger, center of this one. Just be aware. Continue to do the deep up down breathing. Just move your hands to and fro. Slowly, slowly, slowly. Close your eyes. Close your eyes. Try to do the deep up down breathing. Okay. Then rotate to and fro movement. Continue to deep up down breathing. Now, anybody would have felt anything in between your hands? Anybody can share your experience? Anything you felt?
Like air.
Okay.
Finger gets a bit cooler.
Yeah. Okay. Good. Others. If it doesn't feel fine, no problem. Somebody can feel warm, somebody can feel cold, somebody can feel tingling, or some numbness feeling, or some pressure sensations. Somebody can feel the pressure sensation. Somebody can feel repulsion of your both hands. Somebody can feel some globe of something is there, round thing in between your hand.
Yes.
So some people may not feel anything because the hands are not yet sensitive. Because this is what the energy.
You can feel some sort of pressure like in the
Yeah.
hands.
Yes.
Yes. Good.
Energy.
Yeah. This is what the energy. This is what the pranamaya kosha, what you are feeling in your hand is is the energy or the energy body, or in an Indian context, we call it as Pranamaya Kosha. So there, your energy is stored, energy will be there. So where as a yogic healer, we work on this Pranamaya Kosha because this has an integral connection with your physical body. Through multiple nadis, to multiple chakras, it connects to your physical body and it helps to heal. Right? Okay. You might thinking, okay, there is some energy. How my mind, thoughts, depression, everything should help. Okay. Now again, hold the hand like this. Do a deep abdominal breathing. Close your eyes. Everybody close the eyes. Need not to see me what I'm doing. Just close your eyes. Put your hands 1 feet apart. Remember a most happiest event in your life. Just recall that happiest event. Wow. I'm so happy. Just observe, just feel the energy in between your hands. Feel the repulsions or any sensation what you're feeling in your hands.
I can feel sensation in my palm. Yeah, I can feel moving.
Yeah.
Yeah.
Now, okay. Now what you do is, now you recall the worst event in your life. You doesn't like at all. You hate the person or something which you are unpleasant for you. Just recall that. Put your hands apart. Try to recall. No, I don't like this. Che, it is not good. I hate this person. Now you observe the in between your hands. What is happening to your hands? What is happening to the energy in between your hands?
Stopped.
Okay, are you feeling anything? Any differences there?
Nothing there.
Yes.
You have
Stop.
a negative. Yeah.
Yes. There is.
Okay. There
Did
is a
not
difference,
felt
right?
any pressure.
But when you see, when you just recall the happiest event, what you felt?
A lot of movement and a
Yeah.
warmth.
Yeah.
And felt lot of pressure as well. Yeah.
Yes. So when you recall the hatred moments or a worst moment, so you didn't feel anything. So it means that it is very obviously means that there is a difference of energy in happy as well as the worst. So it not only is there in your mind, it is these emotions are there in your aura. Unless we release these energies from your pranamaya kosha, it will not going to help. Medicines may not going to help you at all, because you take the medicine, the moment it will be there, but your energy body still have that traces, still have that energy. You have to release. Okay, that's where the healers come into picture. They will help you to realize. They will help you to release these energies. Okay, so now you are able to experience the energy body. There is an energy. There is a different sorts of energy. There is a different kinds of energy of different frequencies. If something can be hot, cold, tingling, there are different sides of energies are exist. We are living in a energy of ocean. Okay. Now we'll go to the presentation back. So how many of you have experienced anything?
It's just calm
Yes.
down.
Yes.
I did.
Can you show thumbs up? I have done 2 thumbs up because I experienced more.
Yes.
Yes, very good, very good, very good. See, just we'll give a clap. Right? It's a new dimension. So your
Yeah.
Vijnana Kosha is open. New thing you have learned. Okay. I'm going to share again the screen. Okay. So pain you have experienced the different vitality, the energy body you have experienced the emotions, different happy, mood, everything. You got something new idea that okay, there is an energy thing which exists. So if we work on this, we will get an ananda. This is what the Panchakosha. This we have done it. So this is what we call it as multi-dimensional existence of the human being. We exist every moment, every day, every minute with this existence. So we go back to again, what is the basis of our life? We have physical body, right? Gross earth, we have heartbeat, we have brain works, we know that brain works, we breathe, lungs works. So we are physical body exists. We have a prana, we have a life. So our prana, the pranamaya kosha exists. We have a mind, we have a thoughts. Okay, our manomaya kosha, we exist in that. Because if any situation, physically we react, act with the prana, means it's a driving force for us. We have produced thoughts, we produce emotions, we live in this. Then we have an instinct, the intuition, the sixth sense we have. We live in Vijnanamaya kosha. Ultimately, when we work on all these things, we go to a phase of Ananda. When you accomplish one task, you will go to a phase. Because to accomplish the task, you need to work on all these koshas. So this we call it as the physical body, the Annamaya kosha. The yellow one is the Pranamaya kosha, nothing but the energy body. The Manomaya kosha, nothing but your astral body. The Vijnanamaya kosha, nothing but your the instinct or the intuitions of the wisdom. The Anandamaya kosha is a state where you are supposed to live. Because the person is balanced physically, mentally, emotionally, everywhere. The person lives in Ananda. Is it clear?
Yes.
Because Panchakosha, they are different. Okay? They exist because we live with it every moment. We work with it every moment simultaneously and synchronously. When this work hampered, your synchronicity lost, or when you are not working in synchronous with each other, then the disharmony starts, and the disharmony leads to diseases. Then what is this biofield? Biofield therapy, yogic healing is a one sort of energy-based system, because in under NHS and the common terminology which they have used for all the energy-based system is biofield therapy. Then what is this biofield means? Why it is called as biofield? Bio means a living. Field means a territory which extends beyond or extends till some extent. Means if this is the living being, there is a field around it which extends. It's a living field. Okay, so biofield is a field with a life in and around the living being. That's why we call it as biofield. For instruments, we call it as field, magnetic field, or some other field we call it as, but we never say biofield. Biofield only for the living being. See, you would have, when your childhood, you would have seen when the electricity passed through the wire, when we connect to the battery, there is a magnetic field produced around the wire. But similarly, in our body, we have so many bioelectric currents, like a heart, because the heart has to beat, means the electricity has to pass across. If the brain has to work, means EEG has to come, because EEG is the one of the mode of showing that your brain is working. Because if you want to declare the brain dead, your cortex should not work, your EEG should become flat. So this is what, when these are the one of the currents which routinely what we see is a ECG and a EEG. These are the two modes. But these type of bioelectricity exists in our body in each cell. When all together club, it forms an electric field around the body. This is what the bioelectric field or a pranamaya kosha. So biofield therapies are nothing but a non-invasive therapy and no-touch contactless therapy. Okay, because here we are not going to touch the patient. It's a distant one. Sorry. Here, practitioner explicitly work with the client's biofield. Means the persons or the patients or the client's biofield where we are going to interact with it and we are going to modulate it. When we are modulating the bioelectric field of a person, it intends to modulate the physical body and helps to accelerate the recovery and the process of healing and its sustenance. Because not only it has to sustain for longer time. That's why even some people will be like, there is a gallbladder stone or gallbladder pain is there, they've done a surgery, but still the pain persists even though removing up, because in the energy body, it has not yet healed. That is one such example for that. How does it work? Which I already told. Because see, why there are different layers, different colors? Because each mind, thoughts, and emotions are energy having different frequencies, different colors, different this one. So that's why they separate with each other. But they work together to make the synchrony or the harmony of the person who lives with it. So this is what the RF photography, which has been captured by Kirlian photograph. This is a person's aura. Okay, this is before healing, because some part of the things which has been the aura is not way bilaterally symmetrical, as well as there are some part there is no energy at all. But after healing, this equalizes. This is one of the proof that after healing these changes occurs. I have worked with this for one of my, in my early days of my MBBS. When I was doing an MBBS, I was just doing one of the study for children who are scoring less than 35%, means who are getting regularly paid. We worked on them. We did some of the exercises, some of the meditations, some of the healing, and we recorded this Kirlian photographies GDB via GDB camera. How was their aura prior? After 3 months of continuous therapy, how the aura become? So we could able to see this modulation, this modification of this energy aura that was able to correlate with the increase in memory. They are all, except 2 students, everybody scored more than 65. Who was scoring less than 35, we are able to bring them to 65. Is it not a great change? And that was correlating with this aura changes also. Means this memory, even though we think it's our brain, but energy plays a role. Okay, let's go. How it is related to yoga, you might be thinking. So because we are telling yoga-based biofield therapy, because see, yoga has a different meanings. One of the meaning is a union of body, mind, and soul. The other one is any action when you're doing with a skill. Yoga karmasu kaushalyam means a skillful action. Any act you do, whether it's a healing, whether it's a chanting, whether it's a yoga per se, or anything with skill, if we add into it, becomes yoga. Okay, that's why we call it as work is worship. How can work can become a worship? Because it's a skillful action. Yoga has multiple dimensions, because we always, when you think yoga means, we only say asana. Asana is one of the dimensions of yoga. Yoga has multiple dimensions. One of the most commonly multi-dimensional yoga is Ashtanga yoga. Why in Ashtanga yoga, asana is only one part, but there are many parts which are related to this Panchakosha, what we use in our yogic healing. Because yogic healing work on physical body, works on the pranamaya kosha, works on the manamaya kosha, vijnanamaya kosha, and anandamaya kosha. These works at different dimensions. Okay, how this going to help to overcome my problem? Because we are given the clinical scenario. This is a lady who was 25 years old. She has suffered so many things. Okay, here it helped to heal the physical body, because this is the pranamaya kosha and integrating center with all the above koshas and the below annamaya kosha. It heals your mental and emotional problems, helps to maintain your state of ananda, and it communicates all the koshas can be balanced with this pranamaya kosha. The simplest example how this can be balanced is the pranayama. That is the grossest form of balancing the whole body, mind, soul with the prana. That's the vital force is pranayama. So when we are coming to the yogic healing per se, here the beauty of the yogic healing science is we work systematically like how our allopathy system works, because I'm an allopathy doctor, right? So I always try to incorporate what I have learned in my research into this and this to that, because both are same only. It's obviously any system which exists on this world has their own truth. So first is when the patient comes in allopathy, what we see when you want to take for examine, what we will ask a consent. Shall I examine you? Can I examine you? If it hurts, let me know. If any discomforts, let me know. Will you not ask? Because most of you people would have visited, right? Visited the hospital. Will the doctor ask you or not?
Yes.
Yes, right? So here also, unless you, the patient, gives the permission, we cannot do the healing. Or unless the person permits. It's like we are doing a surgery, because when you want to do a surgery, we'll take a consent, right? These are the possible things, these are the things, these are the outcomes, these are the risk, benefit, these are the outcome you're going to get it. Similarly, we also take a consent. Here the healing can be distant or in person. In person means person sitting in front of me, I am doing the healing. Or a person who is sitting thousands of kilometers ahead, like you. You people are now thousands of kilometers ahead. Thousands of kilometers away from me. So in this case, we'll be using a distant healing techniques. You might be thinking how this works, a distant healing. Because if you want to know that Biofield works, means okay, in person you are doing something healing and it works, but how the distant? It's like a telepathy. Means two persons are separate, but they are able to connect because they want to get connected. When you give a consent, you are obliged to get connected to us, the healers. So our healers will ask, can I diagnose your problem? Because they are not just doing healing. Before doing healing, like any other doctors, we need to diagnose. Like how they will use different blood tests or different modalities of tests to diagnose here. Here, the healers they are very much specialized. They are trained years together. They know which kosha is affected. They can able to tell which kosha, if that kosha is affected, what to be done for that, how to overcome, how to do the healing, how to guide you people to build that kosha, how best method I can use to bring the best outcome. And they are trained like how the allopathies has been tried from an MBBS, see the common cases, then go to MD, specialization, treat some specific cases, then super specialization. They have been trained with years together. They have been trained to look at those particular koshas, how it is. So they're going to ask, can I diagnose your problem? Can I do healing for you? These are the things that belongs to a consent, also mobilizing each other. This is what the specialization of healer. They are not just like any person who just do a routine healing. They are beyond. They'll be able to deal with your koshas. They will be able to identify your kosha problems and how to work with it. Is it clear?
Yeah. I understand.
So you have heard it. Okay, now how to believe it? Because I told energy is there, you believed it. No. You might, okay, somebody is telling, okay, I accept it. But when you felt with your hand, you accept it, right? So we want proof, we want a different feeling. Because only what we see, we believe. But energy you cannot see with your eyes. So you'll be feeling through your hand. So you felt it, so you accepted it. Now healing works or not? We need to look into, right? Because when I entered this field 20 years ago, I came into this field to say, to disprove it doesn't exist. It's like an electric field. Electricity was existed before the bulb was invented. Okay, before the bulb was invented, electricity existed, but we did not know. But when the bulb was invented, so the electricity existed, we came to know because it has manifested. So healing is such a thing that because we are not aware, we might be thinking it may not exist. But when we experience it, we believe it. Why all these things is because people are suffering with these things. They are not only suffering with the physical, mental, emotional, they are suffering, they are crippling. There are so many elderly people I am seeing, they're crippling because physical body is aged, but their mind is still active. They want to be happy, but they have multiple things. How to start? These crippling things are made me to think there might be some other dimension which I can give something to others. Okay, it is not just the medicine which works, because over passing through 15 years of my rigorous medical training, I realized that, okay, I'm giving medicine, but where I'm giving time for them, where I'm giving modulating their energy, where I'm modulating their vital force, thoughts, mind. Because counseling, I think counseling, okay, after the counseling, they become better. After 1 day, 2 day, again the same old pattern. This is what the state of a person made me to think there is a different dimensions, which made me to come again with the same ideas. I need to reach the people. So I took this occasion to reach you people with this. Okay, shall we do an experiment with this again?
Yes.
Who want to become a volunteer? I want one person.
Yes,
I don't mind.
I don't mind.
One person, please.
Two now.
No. Currently, at this point, because we can do for one, because yes, we can do later.
I don't mind.
One person, because it takes time. Because I have, Madam has told 1 hour. Because you will also should not run time, no, because already it's the evening time. You also need to have so many other work. So we need to end up in stipulated time. So I want one person who can switch on their video, and I should be able to see them.
Okay, I'm on the video.
Yeah,
That's it.
and same.
Yeah.
Yeah,
Let me see.
What is your name? Tell your name.
Tell
Hemaxi.
me. Huh?
Hemaxi. HA.
Okay, Moto G9 Plus, right, ma'am?
That's right. Yeah.
Yes. Okay. I'll show my healer. Okay, they're going to scan you, and they'll try to look at your which portion is affected, and they try to help you to overcome your problems. Okay. First, now my first question will be: what is your main problem? One single problem, or any pain if you have.
Yeah, my main problem is when I had a flu, I was sleeping, so my nerves traps in my legs, and I've got difficulty in walking.
Now, what is the problem? Now, also you are feeling more difficult in walking. Now, at this point of time.
That's right. It's still, disturbing me not to walk fast, and I'm limping. So my muscle pain has lost. I mean, I can say that I have
In one particular part you are having pain, so that you can gauge the scale.
It's beyond the legs, like muscle cuffs.
Okay, calf muscle pain is there. What is it, if you want to say, grade it, the severity, 1 to 10, how much you are grading it?
It is painful, because when I go shopping or anything, I can hardly walk. And
Okay. Now you are sitting, right? How much is the pain now? It's grade 1 to 10. You might be 10 is the worst, 1 is the least, and 5 is average.
About nine, I can say, so painful, but I have to struggle. Sometimes I have to take a painkillers, but I avoid. I'm a person who doesn't like to take any medicine.
Okay, fine. Vijay Lakshmi, can you Vijay Lakshmi or Lakshmi, anybody can come on to this one? We will switch on your video. Just a second, I'll introduce our healer.
Thank you.
She will going to do healing for you. Yes, she is our senior healer. She is Vijay Lakshmi. She will going to do healing for you. She will going to do the scanning.
Thank you.
Okay, just okay. Namaste. Fine. What you are supposed to do is you are supposed to close your eyes.
Dr. Sharath, I am not able
Yeah.
to see the lady face video.
No, you can just in the search, you pin it into Moto Gene 8 Plus.
Phone gallery view.
Shall I raise my finger?
Yeah. ವಿಜಯಲಕ್ಷ್ಮಿ ನೋಡ್ಲಿಕ್ಕೆ ಆಗ್ತಾ ಇದೆನಾ, ಕಾಣ್ತಾ ಇದೆನಾ? ಸ್ಕ್ರಾಲ್ ಮಾಡಿ, ನೆಕ್ಸ್ಟ್ ಇದಕ್ಕೆ ಹೋಗಿ.
Maybe if you stop the screen share, she should be probably able to see her.
Oh,
Yeah, I'm here.
Yeah. ವಿಜಯಲಕ್ಷ್ಮಿ ಕಾಣ್ತಾ ಇದೆನಾ?
Yes.
Okay. Sorry, I forgot your name.
Hemaxi.
Hemaxi. Okay. Can you just close your eyes? Hands like this. See here, see here. Just see. Hands will be in a receiving posture like this. Yes. You put it on your lap. Close your eyes. Okay. Yes. And you can chant whatever the mantras or whatever the chanting, which irrespective of any religion, depending upon your religion, your likes and dislikes, you can do that. Vijay Lakshmi, you ಕೇಳ್ತೀರಾ ಇದನ್ನ? Just can I do healing for you?
Yes.
Yes.
Namaste, ma'am. Can I do the healing for you?
Yes, you can, ma'am.
You ready?
Yep.
Oh. Shall I start, Dr. Sharath?
Yeah, you can start. Madam, you keep observing what is happening to you, just physically, where the pains are there, how much is the pain intensity. Just keep moving. Just look, be aware of the physical body, what is happening to it.
At the moment,
Just
I
be
can.
aware of your thoughts, emotions, pains. Be aware about the happiest event in your life. Other people can look at the Vijay Lakshmi. She is doing the scanning. She is trying to diagnose which kosha is affected, which chakra is affected. She is trying to get the information for her to do the healing. It takes around 5 minutes. Finally, we can keep observing. Madam, you can keep observe yourself. Try to do a deep abdominal breathing. Just try to relax. Be aware of the happy event. Try to recall it. Enjoy it. You can think of the God, whichever you like. I'm also simultaneously doing things.
Is she having pain in calf muscles?
Yes.
So she as a healer has noticed some of the energy disturbance in her legs and the calf muscles, lower part of the body. Be aware of your calf area. Now, just be aware. Observe that.
Is your left leg is more affected?
That's right.
Yeah. Dr. Sharath, can I continue the healing, complete thorough healing?
Yeah, you can continue the thorough healing. Do you have any indigestion problems, ma'am?
Yes, you are right. Yes, I have to take Sudarshan Churna every night to pass my motion. Yeah.
Yes. So some part of your pains are related to some of the chakras, which they have in connection with your some of the hurts or the irritation with you, irritation or frustration, something, some deep hurts which have been now or in the past or in the present. We don't know when it is there, but there are some deeper hurts which are causing this pain. Okay, if you try to, our healer will try to help you to release those things. Okay, now be aware of your hands, be aware of your head area. Is there any difference with your the feeling in the hand area and the leg area? Are feeling any vibrations things or
slowly and steadily, not that much fast, Yeah.
Yeah. Yes, good. You are able to observe. Very good. Because the energy changes are very subtle. They're going to be very, because as and when we become more sensitive, we start feeling those energy pulsations, repulsions. Because one of the chakra, when I'm scanning, I'm feeling it is pulsating. It is having a lot of pressure. So it is lot of dense energy there. And there are some painful energies. So energy diagnosis doesn't have only just with touching. It also involves feeling it in the form of pressures, densities. It has a temperaments, temperature. We can feel the warm cold, because while doing experiments we felt somebody felt cold, somebody felt warm. So the healer are trained to feel those energies. They can able to make out the energies, anger, frustrations, different sorts of energy they are able to show. Okay, relax. Try to release those hurts, because healer is helping you to release those hurts or pains which are in you, to go away from your pranamaya kosha or the energy body. Now, okay, just let us do a thanksgiving to the Supreme God, the Universal Supreme God, Divine Father, Divine Mother. Thank you for healing me. Mentally say gratitude, express your gratitude. Thank you for helping me to get rid of my pains. Thank you for making me to become better. Thank you for your wonderful healing. Vijayalakshmi ಇನ್ನೆಷ್ಟೊತ್ತು ಬೇಕು?
1 minute.
Yeah.
Just a minute.
Yeah.
Done.
So, okay, done. Okay,
How are you, madam?
Open your eyes. Just walk and sit. Just get up, walk. See, is there any difference?
Because I was sitting on a settee with my legs crossed. So
Yeah.
I have got pins and needles, but hopefully it will work. Yeah, because on the right leg, as I
Yeah.
said, I was
Yeah.
sitting crossed on the settee. So as soon as I got up, I got a pins and needle in that right leg, but left
Yeah.
leg is feeling better.
Yeah. So there is an improvement, right?
Yeah,
How
yeah.
much is the pain score? You can know how much you can quote the pain score.
Sorry?
Now, previously, before the healing, you told your pain score is around 8 to 9. 9, I think I heard it. So how much is the pain now?
Yeah, no pain at all on our left leg now, as I said. So I'm walking nicely now. I'm walking nicely, and let me walk up stairs, because I had difficulty in climbing these stairs. So let me just try 1, 2, 3 steps.
Trying so hard.
Yeah. Sure. So she's too much energized.
Yes.
Okay.
Over energized now.
Yeah, she's over. She is quite excited. Fine. See, this is how the healing works. It works like this. See, she is only clapping. So let us give a clap for her.
Yes, I
Because
can
she has
walk
become-
now properly, and I will
Yeah.
do more walking, because I think when I had a flu,
Yeah.
my nerves might have been trapped, or because all the ladies have this problem of calf muscle, but it is to do with indigestion. You are right.
Yes.
Yeah,
This is
everything.
what the power of healing.
Yeah,
It is the power. How much they will be trained. They have worked almost with the Vijayalakshmi, what you saw, she is almost working in this field more than 10 years. 10 to 12 years. She has been trained in this particularly. She can scan which energy is the thing. So that much is the accuracy. That much is the systematic protocols which has been developed. Okay. Now,
thank you.
options. Yeah. So we'll give a clap to Vijayalakshmi also. Vijayalakshmi ma'am, thank you for doing a wonderful healing.
Thank you.
Okay, now the options of healing, how we means like you can be receptive like how you are and we'll do the healing. Other ways we can give a follow the instructions, the audio will be provided and simultaneously we'll be doing the healing. The other option is you can become a healer, you can do healing for yourself. Along with that, you can take a help. That can make much better difference. So yogic healing as a biofield therapy, it supports you, it rejuvenates you, it accelerates your healing process because everybody has an innate healing process. Because even if the common cold comes, it goes in 7 days, right? But if you do a healing, it goes in 3 days. I can bet on this. It is for a faster recovery, a pain-free life. See, we know how, we don't know that how many years we live, but we know how we can live. That is what the pain-free life, the quality of life. The pain of mind, body, all the emotional pains, so many pains we have to live out of it. That's where the mood elevation comes. That's where the inner peace comes. And when the koshas are balanced, we are at a peace or a state of ananda, at the highest moment of health. Because WHO says health means never says it's only just an absence of diseases. It is the presence of ultimate, the person should be able to execute and manifest his potential. Then that is the true state of health. So this is with this and with this, a new rising sun, a new way ahead. With this, I'm closing my session. Open to the question and answers. I hope I'm clear in everything. Thank you. Thank you for giving a wonderful opportunity for me to present what I had in my, what the inner quest I had, so that I want to reach to people. That was my motto. So I feel I have reached it. Next week, I'll come back with a short meditation, which can make still more better. So now, for a week, I'll give one short exercise. Can everybody can do it?
Yes.
It's a short. It takes 2 minutes for you. Every day, just to record physically what you have, mentally what you have, and emotionally what are the thoughts you are having, mental thoughts, emotional feelings, and your body vitality, low vitality, or really excited, or anything, or no driving force at all, no this one to get up, so and so on, and your inner state, the pancha kosha, the 5 koshas. These 5 koshas, then you daily record it. Which kosha I am having problem? Just record it, write down it. Next week, when you are coming, come back with those things. So you will understand which kosha you are supposed to deal with. You are having a leg pain. I am having only leg pain. Which emotions triggers me? Which made me my pain to reduce? It's not just a medication beyond that. What thought, the instinct which gave you to go to other system or find out is there any other system which can help me? So you are attended. This is one of the 6 instincts which has told you that I might get some solution in this, attending this program. So this is your Vijnanamaya Kosha. When you experienced it, madam, when you experienced it, you feel happy, right? That is what the Ananda.
Very happy. Now, if I can walk, I can help other people. Like what they say, you have to treat yourself first to help others.
No, you can change that thing too. I want to help others, so I'll become better.
Oh, okay.
But I become better, I'll help.
Yeah. Oh, okay.
Yes, right? This is the right approach.
Oh, thank you.
Yes, thank you. With this, please everybody work on this. If you want, I'll just put it in the Neha madam, I just put that homework in the short of this one written format, so people can every day note down your findings. Will you people able to do it? Will you do it?
Yes, yes. Of course,
Yes.
we can try.
Because if you work on that, definitely you become better. The moment you become better, your surroundings, everybody, the atmosphere, whole everything becomes better.
Change, yes.
Yes, with this I conclude my session. Thank you. Thank you, Neha madam. Thank you for giving the opportunity for me to present my views and my experiences here. Thank you. Atma
Thank you.
Namaste.
Thank you. Namaste.